The Ohio Association of Community Health Centers offers the opportunity for physicians, dentists, and medical professionals to build and fulfill rewarding careers. Ohio's federally qualified health centers, FQHCs or community health centers, are located in urban and rural settings throughout Ohio. Ohio's 36 community health centers represent over 150 sites, providing the opportunity to practice medicine the way it was intended.
Health centers have always had that history that it's been about the community. And I think to have a really good, solid health care in this country, they're going to have a really good, solid primary care base.
Been a growing, I'll say, awareness of what health centers do and what contribution they make to local communities. And it's not unusual for me to get calls from physicians who are from out of state even, looking to settle in a good area and wanting to make a contribution to a community.
Physicians in rural communities are still very much revered. They are people that the community looks up to.
Most family docs, I think they want to be, needed, and they feel like that they want to make a difference when they go home at night.
It's really common for us to have the richest person in town sitting next to the poorest person in town. And we like it that way. So when we do healthcare homes, we have to make sure that we cover the broad scope that's out there.
I think community health centers play a significant role in the healthcare of this country. And I think even before this became a national agenda item, healthcare reform, health centers were quietly going about their business for 40 years.
Currently, our healthcare system is really based in specialty care, and it's really based in an illness model. And I think health centers have never believed that. They've always believed if you have really good primary care and you take care of the whole community, that you can really do much more in wellness than you can in the illness model. So I think health centers are set up perfectly to take this country forward.
But it's more than just practicing medicine. It is a way to provide a medical home for communities that in many cases have little or few other options.
We really are on the front lines of delivering services to patients who have very little access to medical care.
If we weren't here, the emergency rooms would be overrun with folks seeking episodic care, no relationship with a primary care provider.
Patients are so grateful because they know that there is absolutely nowhere else that they can go.
And I'm absolutely certain if we weren't there, there would be no option for thousands of people who live in our communities to access primary care.
We did not exist. The patient population that we serve will certainly overload the current health system in our community.
And working at a community health center, you really get a chance to see the impact of developing a medical home, having a primary care provider that knows you.
We communicate with each other. There are more than 1,200 of us across the country. We have networks. We share resources, staffing, supplies at times. So we come together as a collaborative network to deliver the best services we can to people who don't have insurance.
I wasn't aware in school just how much need there was out there. And there's a lot. There's a lot of need. Rural, urban, there's just need all over the place.
Ohio's community health centers offer full-service primary and preventive care, as well as dental. Community health centers provide state-of-the-art technology for patients.
The quality of the care delivered in community health centers is outstanding.
I am very excited to put together, see the whole patient in the context of his or her neighborhood, family, culture, ethnicity. And I'm allowed to do that at the federally qualified health center.
I wasn't exhausted at the end of the day as much as I thought I would be, or as much as my private practice peers would go, oh my God, you're seeing all these people. But they're so grateful.
When you go home at night, you know you made a difference in virtually every person that you saw that day. You made a difference in their life.
For communities fortunate enough to have a health center, there is the opportunity for better management of chronic disease and increased access to healthcare services. The results have been healthier outcomes and communities. There are also professional advantages to working with community health centers: loan repayment, Medical liability insurance coverage and competitive wages contribute to a stable healthcare environment.
Providers at community health centers may be eligible for, which is a big drawing card, is loan repayment. And it's available through the state, but also there's a federal program.
I have no idea what my malpractice insurance is. I kind of like that. So when I get students or other dentists that go, so how much do you pay for malpractice? I don't know, but I have great coverage. I know that I'm covered. I have the maximum amount of coverage with the least amount of headache.
I had a 4-year commitment. I could have left, but we brought our youngest son there, and we liked the community. It was a great place to raise a family, and the practice was growing, and so we stayed.
I started out just seeking my loans to be repaid, fell in love with the patients, with the type of practice, and came back, and I've decided that this is my life's passion.
Ohio's community health centers are a model of how the patient-doctor relationship and medical homes can truly make a difference in people's lives.
It's a very nice place to come. The doctors is very good and very kind, and I like coming here for my health care.
They care about me, and I know that they care about me. They remember me. I don't have to remind them who I am or things like that. They know me.
It's life or death. Very important. Yes. It's changed my life completely for the positive.
Since their inception, community health centers have provided essential healthcare services, professional satisfaction, and rewarding careers. This is what your colleagues have to say.
It's been a great career for me, and I'm working in a rural area where I'm needed and feel appreciated and can practice the whole scope of medicine.
We have to be confident to be in our practices, but people who work for us have worked for us usually for a long time. I have 6 physicians who've been with us for over 20 years, and they say the same thing. It's about the community. They're part of the community, and they really like that.
For those of you who really like to practice what I call kind of hardcore medicine, which is putting all the pieces together, the behavioral, the medical, the social, and understanding you sometimes need to be the specialist in your community. If you're willing to do that and be strong patient advocate, then this is totally the job for you.
Ohio's community health centers provide opportunities throughout Ohio. Whether you desire big city life or life in a quiet small town, Ohio is a wonderful place to live and has something for everyone. To learn more about your career choices, log on to www.ohiochc.org.